Welcome to another segment of NAMI Live, your mental health community. I'm Susan Racher, your host for this program and volunteer board president of NAMI Miami-Dade County. NAMI is the largest mental health support, advocacy, and education organization in the country. We are people with lived experience with mental health challenges, as well as their family members, trained to national standards to help our community with support groups, education, and educational outreach. And everything NAMI does is free of charge to the community, no questions asked about income, state of residence, or anything else. All are welcome. Today, our program will focus on mental health in the Black community, a very, very important topic. And as with all of our programs, this program will be packed with information and actionable things that you can do for your mental health, for your family's mental health, and for your community's mental health. Last week, we remembered Dr. King, who had a vision for his 4 little children and for all Black children in the United States. Next week, we celebrate Black History Month, recognizing and appreciating the contributions of Black Americans to our society and the richness of Black history. Yet here we are 60 years after Dr. King's speech. And his vision for his little children and all Black children remains elusive. And why is that? There are many reasons. Today, we're going to discuss one reason, and that is that Black children and their families are experiencing unprecedented levels of mental unwellness, mental health problems. And we are here to talk about what are mental health signs and problems, where to get help, and how as a community we can work together to remove those disparities of mental health access and treatment to the Black community. And just a couple of level-setting facts. Black Americans are less likely to get mental health care. 70% of Black Americans who need mental health care do not receive it. And there are obstructions to access. There are too few clinicians who have empathy and cultural awareness. So stay with us today as we talk about what is mental health and what are the warning signs of unwellness, where to get help, and what we can work together to do as a community. And joining me in this rich conversation are 2 individuals who've dedicated their lives to service. Reverend Dr. Walter T. Richardson is a 5th-generation pastor. He leads the chaplaincy at Miami-Dade County Police Department. He is chair of the Jackson Trust, which oversees Jackson hospitals. And we are so proud that he is a board member of NAMI Miami-Dade. Welcome,
Thank you
Dr.
so
Richardson.
Much, Ms. Racher.
Shara Johnson has dedicated her life to teaching, is a community leader and a lay leader at the historic St. Agnes Church, and is NAMI's Black Community Initiative Program Coordinator, bringing NAMI national evidence-based programs to the Black communities throughout Miami-Dade. Welcome, Shara.
Thank you for having me here, Susan.
So we are so pleased to have you. So I'd like to start out by reading a quote.
Okay.
And in 2019, the Black Community Advisory Board of Miami-Dade County published a report on the state of the Black community. In that report, and this is pre-pandemic, before mental health problems exploded throughout the country and especially in the Black community, quote, "There is a serious issue facing the Black community regarding mental health and the Black community's reluctance to recognize and acknowledge mental illness and the stigma associated with mental illness. The Black community views it as a weakness, and therefore the conversation is taboo. We all know with mental health conditions, like any other medical conditions, the longer you wait for treatment, the more progressive the problem becomes. Please share with us your insights into what is driving this taboo, the stigma, and what can we do about that?
Thank you. The several challenges exist in the Black community with respect to mental health and mental wellness. But it stems from a much deeper problem. That is, particularly here in Dade County, we've always had that necessary separation of the races.
Mm-hmm.
So when I was born in the 40s, there were not institutions that were very welcoming of Black clients.
Mm-hmm.
Not even talking about psychological assistance or mental health providers. It's just unheard of, and there were so few doctors that were Black to accommodate all the needs. We did not get our first Black OBGYN until 1938, and the community had been viable as a community since 1896. So for all those years, the use of midwives was in vogue.
Mm-hmm.
And so there was this mistrust that if I have a white doctor or a white professional working on my body, we didn't even talk about mental. I was not even on the table.
Right.
You know, people acted quote unquote crazy. They were sent to the crazy house. That's what happened in the 30s and 40s. I remember specifically going to North Carolina with my parents, and the crazy house, as we called it back then, was located in a community. And we would go there on tours just to see people acting unseemly, you know,
my goodness.
and because there was no help for them, no help at all. So when we make that jump from talking about what is to what used to be, there's a lot of information that needs to be shared about the history of Black people's reluctance to even seek, because there's that mistrust there.
Yes.
If somebody white is helping me, what's the benefit to them? Not the benefit for me.
Right.
And I don't think that's often been explored. As a matter of fact, and I won't take too much time.
That's a very interesting, perspective.
I wrote my dissertation about this very phenomena. My dissertation is called Going Through Samaria. It's about two cultures coming together to provide help. It's the story, the Christian story about Jesus going through Samaria, a place where Samaritans live was a place that was despised. Jews did not broach that place. Jesus, being a Jew, chose that place to do ministry. And so the story is that Jesus engages this woman, also a taboo. He's talking to a woman, but he was able to provide the help that she needed. All the taboos were broken. All of the prohibitions were taken off the table. He gave her the help she needed, and she was a changed woman because she had this encounter with Jesus. That's the title of my book, Going Through Samaria. Not going around Samaria, as is implied by the text, but going through Samaria to provide the assistance that this woman needed. He singled her out. Different religion, different culture, different social situation, but it made for a good conversation for Jesus. Initially, it was a bad conversation for her, but she found comfort that he was skilled at what he was doing. And so I took that and I actually explored what would happen if the counselors were if we had more Black counselors talking to Black people.
Absolutely.
Because when I wrote this in 1995, there weren't that many. And I'm sorry to say that even now
it's
in 2023, we still have a dearth of Black professionals in the mental wellness area.
Right.
And I'll stop there.
Thank you for that. Thank you for that perspective, because
Yeah.
what you're talking about is that long before we talk about access to care or knowledge, we have to talk about trust.
That's correct.
And that's a very important.
Yeah.
So Shara, let's talk about, that's a wonderful segue to your work, building trust in the Black community, meeting people where they are. And I know that what brought me to NAMI was that regardless of socioeconomic and cultural differences, the bond that people at NAMI have in struggling with mental health conditions and in helping their loved ones struggle with mental health conditions was far stronger than any culture and any differences of race or religion or economics, because we could relate. And one of your big missions is to help the Black communities begin to relate to NAMI and to relate to each other as they bridge that gap. You
Right.
talked about yourself as a bridge. Tell us
Yes.
the vision.
Well, the vision is to empower the community that they now will understand the resources are there. As the Black Communities Initiative Coordinator, my role is to go into communities such as Liberty City, Overtown, South End, where sometimes we don't make it there, but that's my goal and responsibility, to go into schools so that we can promote the free services that NAMI offers. And I want to piggyback off of what Dr. Richardson said. In our households, it was a way of survival. They did not trust the system, and the system has to be transparent. It's not that people don't want the help, it was the lack of trust.
Right.
And of course, sometimes in our households, it was whatever happens in my house
Stays
stays in my house.
Absolutely.
But now times have changed. People are seeking help. They want the help. So my role is to go into the communities, and I've started with faith-based organizations, community-based organizations. From the training NAMI provided me as an employee to go into the communities to say, the services are here. I've actually used some of NAMI services peer-to-peer, and I'm comfortable with these services. And once I'm comfortable, I can now take it into my community. I can ask NAMI specific information regarding the services. I received the proper training. So now I'm comfortable to share and say to my community, NAMI is here. In fact, they're lining up now.
Right. That's good news.
Yes.
That's good news. And I just want to elucidate peer-to-peer. So peer-to-peer is a class taught by people with lived experience. We at NAMI are not clinicians.
Right.
Clinicians, doctors, psychiatrists, psychologists, social workers are very important to a care team. But we're everything else. We're the community, we're the educational resource. We're lifting each other up. And everything we do is free. Again, no
Yes.
questions asked, no barriers to access. I just, as we segue into and do a deeper dive into these services, I want to frame the conversation with just a couple of statistics so that our viewers understand the magnitude of the opportunity and the work that we need to do to realize that opportunity of mental health for all, which is NAMI's byword. Black adults in the U.S., because of socioeconomic pressures, are more likely to have anxiety, depression, and mental health challenges
Absolutely.
than other groups. Yet only less than 1 in 3 seek help.
That's correct.
Black adults living below the poverty line are twice as likely to need mental health resources, and they don't know where to get them. Black Americans are not often included in research for protocols and drugs for mental health conditions, which means their voices and their experiences are not taken into consideration. And they're less likely to receive standard quality of care and evidence-based care. So and one that's breaking my heart is that we know mental illness precipitates and can precipitate suicide. And our Black kids are twice as likely to die from suicide as white kids, which is a major turnaround from the
Yes.
past, where the faith community and the strength of the Black family were sort of protective agents.
Yes.
Doc Richardson, what can we do as community leaders, as a faith community, to begin to bridge these challenges?
I have 3 words: educate, educate, educate.
Mm-hmm.
Shara used her example of working with faith-based organizations.
Mm-hmm.
A good place to start. And so I would encourage those who are listening to make sure that their ministries, their churches, and to those of you outside of the Black experience, will use that platform. People trust their ministers, their faith leaders, more than anyone else. Faith leaders have
Absolutely.
they have an excellent record
Yes.
of trust, to use that
Yes.
word again, with
Very
their
important.
people. And so, and I don't want to toot my horn, but one of the things that we introduced during the time when I got my doctorate, I considered the fact that many churches at that time in the 90s were getting their congregations involved with social workers, okay? And I said to myself, talking to one of my friends who helped me write my second book, who taught psychology at the University of South Florida, I said, you know what? It would be wonderful if we could start getting churches to add to their staff not only people that are involved in social work, but also in mental wellness. And as a result of that, now across the length and breadth of our country, ministers are getting involved.
Excellent.
If they're not trained themselves in counseling, they have someone on staff, or they have a wonderful referral system. And so there's that area of trust again coming in vogue.
That's
And
the first
so I think
responder to
the
family
first responder,
problems.
okay?
Absolutely.
So educate, and I think we're doing a wonderful job doing this program. Educate, educate, and educate. That will reduce the stigma, you know, of what has been perceived in the past as a real challenge, that you're not crazy, you're normal, you know. And just like you work on physical fitness and and medical fitness, if there's such a term, what about
Excellent.
mental wellness? Yeah.
And you're an
fitness.
educator, Shara.
Yes.
And so in that, share with us your experiences. NAMI has education programs to take that stigma away. Talk with us a little bit about ending the silence, and about our suicide prevention programs and your your perspective and your experience in reaching out to high school students with the Ending the Silence program.
I attended Ending the Silence. My first presentation was at Norland Middle School. The training I received before attending the workshop, it opened my eyes to what kids see it from their point of view. The training NAMI provided me and the uniqueness of Ending the Silence, we actually have a volunteer who's lived the experience to share their stories. And I know it's working because of the feedback from the kids. It's not so much what we're doing, but did we connect with them? And every ETS presentation I attended, we connected with the individuals because they responded. They were educated on warning signs. We include them in ETS because we ask the students questions and they have to stand up so that they could see the ratio 1 to 5. One of you may be living with a mental illness. It's so much education that they can relate to, especially after the pandemic. The pandemic opened up a lot of things where people are now comfortable to talk about it. I think it was a power move for NAMI Miami Dade to even hire someone for the Black communities, because that's the first step.
Right.
Get someone from the community who can now go back and say and share, oh, the resources here. I trust the resources, so I want you also to get involved. And that's what I've been doing. And I do that with ETS. I've had some of my church members who are educators. We've actually gone to their schools to train them on ETS. And even with QPR, Lisa's doing a phenomenal job, and I was trained also as a gatekeeper. So now I'm going into the senior living facilities to talk and train them about suicide prevention, because there's a lot of things we didn't know that we're now open and welcome to talk about and to discuss.
So absolutely, and I will say that Ending the Silence is the best hour or hour and 10 minutes you will spend in ever. We have a module for parents. We have a module for youth, taught by people who have been there. And we are bringing in a module for staff, for organizational staff this year with a grant from the Children's Trust. Question, Persuade, and Refer that Shara mentioned, QPR, is a national evidence-based suicide prevention program. It's an hour and 30 minutes. And it operates under the assumption that we are all, sure, I use the word gatekeepers, just like we need to learn the Heimlich maneuver, just like we need to learn CPR.
That's correct.
If we're in a restaurant and somebody collapses, we have an obligation to learn QPR. Question, persuade, and refer. Our next QPR is on Zoom, February 4th. Go to NAMIMiami.org to sign up. It's free, as everything we do. If you have a community group, a church group, talk to Shara. Reach out to Shara to set up Ending the Silence or QPR. NAMI is NAMIMiami.org. Go to our website, and her information and all of our information will be there. I want to spend a moment, because you mentioned warning signs.
Mm-hmm.
Mental illness strikes when people are in their prime, ages 17, 18 to late 20s.
Mm-hmm.
That's often a time of change, sowing one's oats,
Mm-hmm.
Right.
trying different personas. And mental illness is often not observed by parents or teachers or grandparents. Or if it is, it really is not acted upon. So I want to spend just a minute for our audience. We do this in every program. You know, what is mental illness? You know, how do you know it in your loved one or yourself? You know, sleep habits change. A person becomes isolated.
Mm-hmm.
They lose interest in work or in daily pleasures. Their eating habits change.
Mhm.
Their friends change. Their behavior changes. If you have a loved one or see this in yourself, pause for a moment. And if these changes, and there are many other warning signs on our website, last for more than 2 weeks or are interfering with daily functioning, please get help.
Right.
Yes.
And then where do you get help? You could call NAMI, 305-665-2540. We have a warm line answered in English, Spanish, Portuguese, and French.
Yeah.
You can go to our website for general information. You can, if you're needing more information, we now have in place a national mental health and suicide crisis line, 988, of trained counselors who can refer you to community resources and immediate help. We have an organization called Thriving Minds South Florida. I'm actually a board member of that organization as well. That is an amazing organization. It's one of 7 managing entities in the United States. In Florida, that is funded by the Department of Children and Families to provide mental health and substance use treatment from birth to grave for Miami-Dade and Monroe counties for uninsured and underinsured people. We have a no wrong door policy with Thriving Mind. You can, if you have problems and need mental health care immediately, go to thrivingmind.org. Go to one of their providers. Banyan Health has a crisis unit. Jackson Health has a 24/7 emergency room where you will receive help under the auspices of Thriving Mind. If you or a loved one is in immediate danger, dial 911. And Dr. Richardson is with the Miami-Dade Police Department and knows how well we train our police officers to respond to that. Ask for a CIT trained officer. We have resources in the community. Educate.
Right.
You know, educate on the warning signs, educate it on prevention, such as ETS and QPR, and then the resources. When in doubt, call us at NAMI, 305-665-2540. We will meet you where you are and provide help and support. In terms of final takeaways, for this half hour went so fast. I can't believe it. I'm looking at the time. In terms of what we want our communities to know, share a few final takeaways for the group, Dr. Richardson, and how we can reach out and work together to be effective in this area.
I think you've done a good job reintroducing NAMI to the public, but having our faith leaders and others embrace this as well will be a phenomenal step. Involve them in many of the discussions that we're having. Make sure we get the faith community. They're the most trusted people in our communities. And I think by doing that, we will reduce the stigma.
Yes.
You know, it's very, very troubling that every day in these United States, one statistic that I'm aware of is that at least 22 people in law enforcement and military commit suicide every single day. Multiply that times 365.
Yes.
A lot of people being lost. Most of them because they did not take advantage of the opportunity to have someone to talk to.
Mm-hmm.
You know, I have 2 degrees in counseling. And one of the things that I came up with when I was in school, a lot younger than I am now, was that if you have the time to talk to yourself, you also have the time to talk to someone else.
Right.
So we have to push that, you know.
Right.
If you find yourself, going through the motions of talking only to yourself when you have some serious challenges, talk to someone else. I'll just take a moment to tell you this. When my mother died, my daddy, who was 25 years my senior, by the way, he just passed away,
Yes, I'm sorry.
was not aware of the services that were available, even in grief counseling. And I introduced him to grief counseling. I says, Dad, you, I, and my brother, we need to go. We need to go to grief. He said, what is that? I told him. We went. When we finished the session, we got back home. He said to me, he says, all she did was listen. I said, that's part of the counseling, sir. That's part of it. You weren't talking to yourself.
Right.
You were talking to someone who understood. And when the time was appropriate, said something that will help you from now on. I said, don't you remember what she said? He said, yeah. She gave me some wonderful advice. And so I think we have to do that. Educate, educate, and educate.
Absolutely. Thank you so much
Thank
for
you.
that. And Shara, we talked about support and listening.
Yes. Actually, I was trained in December to now lead a support group, myself and another colleague. So actually, February the 2nd, we will host our first Black Communities Initiative support group.
I love it. I
Yes.
love it.
And where will it be located, and how do people?
This will be on
attend?
Zoom. They can go to the
Easy.
website. It's free of charge. We're going to promote and advertise it to the community, whether it's on social media. If you know me, I'm a text blaster. I'm getting my family involved, my church members, everyone involved, because sometimes, as he stated, they just want to hear that someone is listening to them. My role as the Black Communities Initiative Coordinator, I don't take it lightly. I love doing this. I love sharing with people and helping people, because I too am a person with lived experience. I am that person who went through depression when I lost my father. So I stayed out of work for 4 years. But the resources that NAMI has provided me, I'm actually using those resources to help myself. And I have to share my healing with someone else. And I'm doing that with NAMI.
You have
That is so
captured the magic of
Yes.
this organization and why we are so
hidden
dedicated.
treasure.
It's a hidden treasure, and folks, we don't
God
want it to
bless
be
you.
hidden
Anymore.
God bless
Everything
you.
we do is free. No questions asked, no barriers to entry, no appointments need to be made. Go to our website, NAMIMiami.org. Check out our programs. I would like to also recognize that the work that we do and the community outreach that we live for is supported by the Florida Department of Children and Families and Thriving Minds South Florida, among other funders. The Miami Foundation is supporting our Black Communities Initiative. I want to thank those organizations and all of our funders. Without them, we would not be able to do the work we do and to be able to offer it to the community for free.
Yes.
I also want to mention that under the auspices of the Florida Department of Children and Families, and Thriving Mind South Florida. We have a robust suicide prevention program. You will see TV ads, you will see podcasts, you will see trainings, what Shara called the gatekeeper training, all free, accessible, available. Learn how to talk to somebody if you think or are worried about their safety and their likelihood to self-harm. Be there for your friends, be there for your communities, be there for your loved ones. If you are not comfortable having those conversations, that's fine. Be aware and find someone who can have that conversation with that individual who needs help. Well, thank you for a wonderful program, for your amazing insights, and for the support, love, passion, and dedication that you have for mental health, for the community, and for NAMI. And we look forward to seeing our viewers and on our next program, which will be February 22nd.
Beautiful.
Thank you
Thank
for
you.
joining
Thank
us.
you.
Thank you for having us.